This is a Snellen chart. It should be about 5 meters distance. Snellen chart, Ishihara plates and Ishihara plates. First of all, we should examine an acuity of vision. To assess an acuity of vision, we should use a Snellen chart. As you see on Snellen chart, there are 8 main lines. And normally, patients should see letters from 8 lines. On which, cover your eye, one eye. Right hand. Yes. And tell me the letters. What is it? Okay. Change your eye. Okay. Okay. If patient doesn't make any mistake, it means a good vision acuity, 20 from 20. If your patient made 2 mistakes in if your patient made 2 mistakes in that line, you should go on upper line. Then, if your patient again made 2 mistakes, you should go upper. And from 6th to 4th line, patient can make only 1 mistake. If your patient made 1 mistake, you stay in this line. If another mistake, you go up. And from 3rd to 4th line, patient cannot make any mistakes. If your patient cannot see E letter from distance 5 meters, you should decrease the distance about 3 meters. If distance is 3 meters but patient cannot see, you should decrease the distance about 1 meter, like this. If patient cannot see anything in distance 1 meter, you shouldn't use a Snellen chart. You should use fingers, and patient should count your fingers. If patient cannot count your fingers on distance 1 meter, you should do 1 step and decrease the distance. You can decrease the distance till 15 centimeters. If distance between patient's eyes and your fingers will be 15 centimeters, if patient cannot see your fingers, you should use a lighter. And patient should determine direction of light. Okay, next it's a color test. Yes, we should review a color blindness. Distance between me and patient should be about 5 meters also, and we should show to patient an Ishihara plate. And you should tell me a numbers. First of all, we show this plate to assess contrast vision. Okay.
7.
Okay, correct.
674.
Correct.
Color blindness 45.
Correct. Normally, you should show to patient 13 Ishihara plates. And if patient see all of them, it means patient doesn't have any problem with colorful vision. Next examination is vision fields. To assess a vision field, the distance between doctor and patient should be about 1 meter. And you should cover one eye by your hand, yes. And I should cover my opposite eye, like this. And we should assess according to clock. You should say on me. You should look on me. You should look on me. And now I show you fingers. When you start looking, tell me, okay? It's 10 hour. You see?
Yes, yes.
Okay.
Yes.
You see? Change 2 hour. You see?
Yes.
Look on me, not on my finger.
Yes.
Okay. 4 hour.
Yes.
Okay. You shouldn't change your hand. Let's start again. You see?
Yes.
I'm as a doctor. I change your hand. You should close. No, you should close the same eye. I change my hand.
Yes. Yes.
Now change your hand.
Yes. I see.
Mhm. Mhm.
See.
So doctor should change hands. Patient shouldn't do that. No, only according to command of doctor. Okay. Also, according to your checklist, on optic nerve examination, you should perform a general examination of patient eyes, and also you should assess a pupils. I mean not pupillary reaction, I mean size of pupil and shape of pupil. Shape should be ring and size normal. Okay, and then oculomotor nerve examination. To examine oculomotor nerve, we need a lighter. We need a pen, and that's enough.
Light bowl like light. Light.
Okay. First of all, we perform a general examination. Maybe patient has any ptosis or pupil changes or others. Then we should assess a movement function of oculomotor nerves. We should use a finger or pen. Look on my pen. I place pen on distance about 30 centimeters between pen and patient's eyes. Follow to my pen, but don't move your head. Okay? Follow to my pen. We draw an H letter, like we examine on nystagmus. Okay, and middle position. Next test, it's light reactions. There are two types of light reaction. First, it's direct reaction when we use a lighter. Look in front, look at me, and we check from both sides. Next, consensual light reaction. You should place your hand like this on your nose. Place your hand on your nose, yes. And we light in one eye, but compare the size of both pupils. Both pupils should constrict normally, and in the other side. Okay, you can see a normal pupillary reaction. Next, it's an accommodation test. For accommodation test, you should look on some far object. For example, look on group number.
3132.
Yes, look carefully on numbers. Now look on my pen. And we see convergence. It's an inward deviation of eyes, and we see pupils constriction. It's normally process. It means patient has normal accommodation and convergence. Next, eye covering test. Cover one eye by your hand and look on my pen. We should assess opened eye. An opened eye. Opened eye shouldn't deviate somewhere. Shouldn't change the pupillary size. Okay, change your hand. Okay, eye covering test is normal. Yeah, that's all.